Tonight on the record is investigating an Obamacare replacement plan. Three very powerful U.S. senators say they are ready to swap out the Affordable Care Act with a new plan called CARE. Now, it stands for choice, affordability, responsibility, and empowerment. So how would CARE be any better than Obamacare? Well, let's ask the three architects of this proposal. North Carolina Senator Richard Burr, Utah Senator Orrin Hatch, and Oklahoma Senator Tom Coburn. First, you, Senator Coburn, I should tell you right from the get-go that apparently the White House is rather dismissive. Jay Carney says it's just another repeal proposal.
Not true. If you look at Obamacare right now, you have $1 trillion in taxes, almost $1 trillion stolen out of Medicare. You have $1 trillion that we're going to pay to the insurance companies, and most people are getting less choice with higher deductibles and less access. And so it's not a repeal. It's a plan that actually empowers people to make choices rather than government, allows states to be primal in terms of figuring out what we're going to do, and gives the states the authority and the money to be able to do that.
Senator Hatch, President Obama is hoping that all the millennials they're not going to buy iPads and iPhones, but instead they're going to buy health care insurance. Under your plan, who's paying?
Well, he's found that doesn't work, and under our plan, we actually will provide affordable tax credits so that people can actually buy their own insurance. And we actually will reform Medicaid so that it's a disastrous program right now, but we can reform it so that it will work. We will help the poor up to 300% of poverty to be able to get the subsidies that they need to be able to purchase their own insurance. And frankly, we have a much better format and approach towards solving these problems economically and from a healthcare standpoint as well. Plus, we do something about medical liability or medical malpractice. In other words, we would do something about the unnecessary defensive medicine that basically runs the costs up dramatically into the tune of hundreds of millions of dollars every year. I used to be a medical liability defense lawyer, and I can tell you, and we would tell doctors, you just better have every possible thing you possibly can in your record so that you can show that you went way beyond the standard of practice in the community.
Senator Burr, 48 million people are uninsured, which apparently was one of the reasons President Obama wanted Obamacare. Under your plan, with those 48 million that hypothetically didn't have insurance before Obamacare, would they be covered?
Greta, they'd have a better chance of being covered under our plan than they do the president's plan. Everybody estimates that under the president's plan there's 36 million, when it's fully implemented, uninsured. And the fact is that we do something novel. We address the cost of health care. We go in and start a process through reforms where we provide all the assurances. We make sure that individuals 26-year-olds can stay on their parents' insurance. We guarantee the renewability of insurance, and we mandate that insurers can't create a lifetime limit. But we also go underneath and we begin to reform the healthcare system that we had in this country. The three of us agree, going back to what we had was unsustainable. And I think what we've tried to do is we've looked at it and said, how can we make healthcare coverage more affordable for every American, regardless of whether they receive a subsidized tax credit or they're an individual just going into the individual market.
Senator Coburn, if the White House is dismissive of it, and I take it Senator Harry Reid is probably not too agreeable to this, and I see Senator Hatch laughing a little bit. How do you get this to even to be on the table, to be discussed, even to be looked at to see whether it's a viable and good plan?
Well, it's going to be a viable and great plan. I've got a lot of years in medicine, a lot of years in business, and we didn't get an opportunity during the debate on health care to vote on the Patient's Choice Act, of which a large component of this is. It's not the same. It's different in a lot of ways because we've seen problems. I expect him to be dismissive. We're not going to get rid of Obamacare until President Obama is no longer president. So what we have to have is what are the solutions to the real problems that were both in the healthcare segment of our economy before and have been made worse by Obamacare. And the whole idea of this plan is to give affordable access care where you run your health care and your state makes decisions, and it's not mandated what you'll buy, when you'll buy it. There's no employer mandate. There's no individual mandate. You get the option. And if you want to take this credit, you can.
Well, we'll wait to see whether or not Senator Harry Reid was even a little bit interested in talking to you. Always nice to see all three of you gentlemen. Nice to see you. And coming up, this is a